Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. We have some great guests on the program today. They are from Rely Health. We have Soham More and Prithvi Narasimhan. Hopefully I pronounced that correctly. Welcome to the program.
Thank you for having us, Tom. Appreciate it.
So, Soham, you're the CEO and founder, and Prithvi, you're the co-founder and CTO, correct?
Right.
Awesome. So, Prithvi, tell us a little bit more about yourself and how Rely Health got started.
Yeah, absolutely. Well, first of all, Tom, thanks for having us on and for taking the time to chat with us. We're excited to share our story too. Yeah, I'm Prithvi, and my background is really in building tech products, software engineering at companies like Stripe, Robinhood, and Airbnb, where I focused on making these complex systems more accessible to the end consumer at the end of the day. Healthcare wasn't something I initially set out to work on until I saw firsthand how broken the system was. Yeah, I had this unfortunate tragedy in my family where I had an aunt pass away of breast cancer, and a big part of it was she just did not know how to navigate the care experience. She wasn't getting the appointments at the right time. There was no one holding her hand along the way, and she just sort of got lost in the shuffle. And at the time, I was just thinking, like, yeah, I'm doing this stuff at these tech companies. Is there something I can do to help take those skills and make an impact on someone like my aunt? And at the time, Soham was a pre-med, and we came across this ASCO study that talked about how patients with metastatic breast cancer could live 50% longer if someone checked in on them every week, a nurse typically in this particular study. And that would have made such a big difference for me and my family at the time. And I was wondering, why is this not standard? If the research is there, if the literature is already there, why doesn't everyone do this? And it turns out, as we all know, there's just not enough care navigators or patient coordinators out there. You just cannot staff enough folks in the hospital systems to reach out to every single patient. We can't make it standard of care. And the most annoying part of this is for most of these folks, more than 70% of the day is spent charting, copying data, making basic phone calls and leaving voicemails, waiting on hold for providers to coordinate care. Just simple stuff that isn't really patient focused, but is a prerequisite to the job. And these folks are amazing at talking to patients, empathizing with them, getting them the right care. And we just wanted to imagine a world where we got rid of all that grunt work and allowed them to really focus on what they want to do. Working with patients, empathizing with them, building those relationships.
Interesting. So, tell us a little bit more how you got involved and your story.
Yeah, absolutely. Adding on to Prithvi, as Prithvi mentioned, I was pre-med in college. I spent a lot of my time in a translational oncology center. So a lot of what Prithvi described, I saw firsthand, which is no matter how much effort physicians or doctors put into a visit, sometimes what really determined the outcomes was whether patients could follow through with their care after that visit. So although I was on the path to medical school, by working at this cancer center, I saw this time in and time out. Patients couldn't get transportation, some couldn't take time off work, others were just overwhelmed, but the system was just expecting them to figure it out and come back on their own. But many times when they didn't, it would either delay care or they would come back even sicker. And at the same time as Prithvi and I were thinking about all of this, we saw the companies like HIMSS, Omada, Curology. These companies were unbundling healthcare services and delivering them very personalized and very consumer focused to all of their patients. And they weren't just adding technology, they were making sure care is structured and accessible. So that contrast really stuck with me, how care was delivered in companies like that versus how it was delivered at the cancer center. Quite frankly, it was the exact opposite. So that's when I realized I could make a bigger impact by not being a physician, treating one patient at a time, but building systems that could help thousands of patients. And really that's what we're doing at Rely. We're helping hospitals, health systems, making sure that the patients don't just receive care, but are connected to it. We follow up with patients. We ensure they have a friend in the healthcare business as they go through many, many different care journeys and care episodes. And of course, AI has only made this more efficient and scalable. As a belief, we think that care coordination isn't just an operational function in healthcare, it's really the backbone for what makes healthcare work. And if we want to really reduce costs, we need to spend a lot more time thinking about how we provide better care coordination. And that's why Rely really exists as a company.
Yeah, I think you guys both nailed it. The audience knows I have myself communicated. My father had many complications to diabetes, 4 amputations, and my mother passed of cancer. My father-in-law had Parkinson's. Those are the hardcore needs of healthcare, and if you don't have advocates, it's tough to navigate the system because they're not coming to you. You have to go to them. And care management is core. So one of the things I always say is, the average Medicare patient with 5 chronic conditions, 9 different doctors in a given year based on CMS data. I'm in front of my doctors, all 9 of them, 15 hours in a given year. What happens the other 8,745 hours is really what matters in most part, because the doctor might tell me to do some good things, might prescribe medicines and say, take them and say, and here's your care plan. But if I don't execute them when I'm outside of the medical office, I went through all that headache and all that cost and I didn't do anything about it. Because oftentimes, just like an athlete needs a coach to get to the next level, patients need coaches too to ultimately educate and change behavior, help change behaviors. And it's that changing of behaviors that ultimately gets us to a different degree of care. And so that care management, whether it's a person or the leveraging of AI to help facilitate that engagement, is, I think, the differentiator in this innovative care transformation model. So with Rely Health, implementing AI. So let's understand more about what you guys are doing relative to AI and how that truly does impact care. Prithvi?
Yeah, I think that's spot on. Healthcare has really lagged behind in tech adoption. If you look at other industries, finance, logistics, customer service, they've all been transformed by tools like Salesforce, Slack, Jira, and Notion. These platforms not only made workflows faster, but also more efficient. But as we know in healthcare, this hasn't really happened. We know that EHR migrations take years to complete due to complexity. Hospital IT is backlogged with hundreds of requests from internal teams, that no one really has the time to develop and deploy new technology. And in fact, a lot of the times we've seen when new technology is deployed, it just creates more work for clinical staff. AI or not, if you give someone a bunch of workflows and expect them to start using it alongside their existing complicated clinical workflow, it's just going to end up adding to their workload, not taking away, even though we like to think otherwise.
Yeah.
And I think the other part is every care coordination team and every nursing team is so different. Each have their own custom workflows, and it's impossible to have that one size fits all solution for everyone. But I think that's where AI is different. With AI, that long tail, that 20% of tasks that coordination teams take care of, that nursing teams care of, are different, can now be tackled for the first time through some level of automation. So rather than forcing some team within the hospital system to use our software, what we end up doing is we actually hire our navigators internally who are trained on the software, and we use a split of that human and AI power to get the job done. And I think that co-pilot mechanism is really where we're able to capture that entire role in a better way than before. AI will automate more and more of that grunt work over time, but we still need that human in the loop because that long tail will always exist. And the more we can go towards that long tail, the better, but we're not fully there yet. And the other part that's really important, this being healthcare, is the human empathy side of things. You can clone an AI to sound like a human. You can make it emote. You can make it respond the same way we do in every single way. But it always lacks that human element. And when there's a patient who's going through a substance use issue and needs rehab, to get that patient into rehab, you need that human touch. So the AI really ends up being a co-pilot in that situation, taking away as much of the grunt work as possible. But that human, that navigator, is responsible for developing that connection. It's really how do we make it symbiotic, not replacements.
Yeah, all great stuff. So, Previ said something interesting and it stuck out to me. Aside from the great things and your unique approach to implementing AI, physicians, it's tough to get a practice to adopt new technology. With all due respect to their great efforts, they have this waiting room that is just full with patients, and they're charting every day, all day to separate themselves and to think strategically and to make investments in how can I do it differently, it's a very tough road. And so hospital systems, the ones more likely with dollars, is actually the location where we want to keep patients out of, right? So how do you address that dynamics of how do we get physicians that are in that primary care practice, internal medicine practice, to adopt technology so the reduction of admissions is ultimate and lesser utilization of the emergency room is ultimately realized?
No, that's a fantastic question. And quite frankly, the answer to that is that it's really hard. Technology has been rarely adopted by a lot of these industries, particularly healthcare. And at Rely, we were facing this problem ourselves, where for the longest time we were building technology for navigators and coordinators. But I think in March 2023, that's when we really shifted our thinking, which is for us to move these programs into these large enterprises, particularly health systems and payers. Instead of technology, we want to move into labor. And that, I think, was the critical unlock for us as a business, which is health systems today, they are already short hundreds and thousands of physicians, nurses, and affiliated kind of lower wage healthcare jobs. And that is putting a huge strain on the system. That number is only going to grow over the next 5 years. And at the same time, medical care is getting a lot more complex. Patients are living longer with chronic conditions, more diagnostics, more treatments, and more data to process. So when we look at it from that perspective, and which every health system is, that labor issue is a critical crunch. So what Rely does, as Prithvi mentioned, is we really build these hybrid labor programs that consist of empathetic human patient care navigators in your emergency department, along with advanced generative AI agents that handle a lot of the low risk, non-diagnostic, patient-facing tasks. And what that does is it opens up time for these human patient care navigators to really focus on empathy. And we've worked with a large health system in the Midwest, and one of their biggest issues was, as you just mentioned, EDs are overwhelmed, not just because of patient volume, but lacking resources, lack of coordination, lack of follow-up. So patients would leave the ED and really get lost in the system, and many times end up right back in, treat the ED as a PCP. And that's where AI has made the real difference for us. We don't need to put in 6 to 10 different patient care navigators in that ED to solve this problem. Instead, we only need 1 or 2, while the AI can automate follow-up, manage scheduling, surface key insights. All of those things can be freed up to allow that smaller size team to then focus on the complex cases, the cases that require empathy and really coordination that's deeper than routine logistics. And for that same health system, after implementing this AI-driven navigation, we were actually able to cut their 180-day revisit rate by 51%. And this is
Wow.
without them having to add any more staff. And that's really the point here. We're not going to solve this by hiring more people, even though this is fundamentally a labor problem, not a technology problem. We're still not going to solve this by hiring more people, just because we don't have enough navigators or coordinators out there to meet these roles. So this is where AI has to come in to help the folks we already have and make them significantly more effective.
Yeah, I would agree. At the end of the day, we have a growing, larger, sicker population developing more and more chronic conditions and less doctors and nurses to take care of that population. You can't do it by hiring more people. Because the skilled resources necessary just aren't there. So you got to leverage platforms like yours to offset and engage. And I'll be honest, I normally don't demo platforms of folks I bring onto the program, but I was given a telephone number to dial and just to kick the can a little bit. And I couldn't tell if I was talking to an AI agent. I wasn't talking to Alexa, that's for sure. Because it's more, Alexa's more, I say Alexa because it's robotic. It's got this robotic voice to it, right? I couldn't tell. It was an awesome experience. So to me, I was talking to somebody. And if I was a patient, I would have been empowered to engage more and more. But it did the job, and it knew where to traverse the conversation, if you will. Even though it might have been scripted on the back end, it was very powerful. And to me, sitting where I sit relative to the services and the way I engage healthcare, I was like, yeah, Someone called it AI, but I was talking to a person, not technical AI, if you will,
Right.
right? And that's really, I think, the gravitas that you bring to the table is that it's a person. At the end of the day, I feel like I'm talking to somebody. I feel like they knew me. I felt like they were trying to help me, and it just drew me right into the process. I thought it was probably one of the best AI demonstrations I had, and I did it all on my own by just dialing a number, and somebody answered the phone. An automated attendant, if you will, answered the phone and guided me through a conversation to schedule an appointment. So tell us a little bit more about how your overall team incorporates it all to help a practice ultimately enhance patient engagement and ultimately guide them on what I call the 2030 model, where everybody has to engage in a value oriented program. But a lot of doctors just don't know how to get there. You have to adopt technology. It's a data driven model on how to get the value to some degree. What are your thoughts? Soham, I'll turn it to you first.
Yeah, absolutely. So our goal is to see that impact play out in real time. So really what we go after is when systems are hiring these roles, as I mentioned earlier, we're going after that labor budget. So when systems are hiring navigators, coordinators, peer specialists, discharge specialists, and the nomenclature really varies service line by service line. That's one of the hard parts about this problem. There's no one single care navigator that's commonly understood across all of healthcare. Instead, every service line has crafted what their own nomenclature is for this type of role, and the definition of the role is building patient relationships. So that's really what Rely goes after, where we work with health systems and organizations of all sizes to help them understand their staffing picture when it comes to this role. And there's really three ways to go about it. Either you're fully staffed and you don't need to add on any more personnel, and now it's an efficiency problem. You're constrained by costs. You've spent up the entire budget for this role, and now it's all about making that budget more efficient. So for that end of the market, Rely really helps by providing back office virtual support, which is your team takes care of all the important empathetic driven conversations. But all the follow up that happens after that, scheduling, reminders, adherence, all of that will be done by the Rely team, virtual navigators and AI agents. So we essentially take away work from your plate to allow you to do the most high acuity work. Along that comes our virtual team, along with these customized AI agents that we design for all of these enterprises. And on the left-hand side of that scale is systems that are very new. They're not created their care management strategy yet. And for those types of systems, Rely not only builds that virtual and AI agentic support, but we also staff local, real patient care navigators that are hired in that area, know the resources, know the population into those settings. And what's really interesting about that is if you look at attrition rates for this role across the industry, it has a very high rate of attrition. The average time navigators spend on the role is typically less than 2 years. But we're really trying to fix that at Rely, where we want to make sure our navigators stay with us throughout the course of their healthcare journey. And the way we make that possible is that we're transitioning this role to something that's blue collar to something that's more white collar, which is our navigators, they manage technology, they manage agents, and this allows them to scale to thousands and thousands of lives, where historically case managers typically see 100 patients a month. Our case managers on the other side see 15 to 20x more that with an average of 900 to 1100 per month. So what that goes to do is we get additional value to these health systems and we charge for that value. And we make sure that our navigators also get paid more and increase their salary ranges as they navigate more patients. So essentially, we're redesigning what it means to be this population patient focused relationship type role and moving it into the modern AI age. Prithvi, you want to add on to that?
Yeah, I think that pretty much encapsulated. And yeah, at the end of the day, our operational goal is to really understand what our navigators are doing, how they call patients, how they track down doctors, how they juggle referrals, how they navigate broken systems. And whenever we did this, we saw something surprising. About 80% of their job was just process, scheduling follow-ups, making sure paperwork goes down, tracking down information that should be readily available. It all needed to be done, but it didn't always require human intuition. So we asked the question, what if we could just automate these low-code tasks so the navigators could focus on building that human connection? And that's when we started. We started building tooling that allowed us to create automations for our navigators, leading to that 10 to 15x improvement that we're seeing today.
And we spent about 3 to 4 years actually doing this. It was not an easy problem to solve whatsoever because it was so varied and disparate site by site. But then in March of 2023, we then saw a huge opportunity where instead of just providing the software layer, as we talked about earlier, we wanted to now move into staffing as well. So in March of 23, we actually acquired a patient care navigation company called Healthful. Healthful was embedded in emergency departments across the country, and it was owned by Vituity, one of the largest ED staffing organizations in the country. That was the moment everything clicked for us. We spend the past 3 to 4 years building software for this role and really understanding how we can design these agents to perform work for these team members and do so in a very personalized manner. This involves having these team members, these navigators, customize and build their own workflow agents. So that technology took years to kind of flesh out. But once we did that merger, we saw exactly what we wanted to see, which is our technology enabled us to figure out which workflows were working and which could be fully automated. We saw how much time was being wasted on manual coordination, how much the AI could help. But the key thing is we knew our lane. We never touched clinical triage or direct care. Our focus has always been care coordination and navigation because we believe AI can have an outsized impact there. And that impact is really the backbone of healthcare.
Interesting. What do you say to those folks that are looking to explore the use of AI and the insights or the feedback relative to where there's bias or where there's safety concerns in the use of AI? Prithvi, what are your thoughts on that front?
Yeah, I think one of the biggest concerns that we have to have as an industry is that idea of AI safety. How do we ensure that this AI, which is at the end of the day probabilistic, has reliable, accurate outcomes that actually improve quality of care, instead of introducing these new risks? Even as AI gets better and better, at the end of the day, we see humans as co-pilots for the AI. AI today can take on these low acuity tasks really well, calling patients in to do a brief check-in, non-patient facing tasks such as charting, appointment scheduling, so on and so forth. But at the end of the day, with all these tasks in the healthcare setting, we have to have humans who are at least given a summary to keep everything in check. Someone needs to have the AI pass the sniff test at every single time. For patient-facing tasks, for example, stratification by acuity is critical. When patients really need help, we first find whether they want to, we check if they want to talk to a human being or not. We make sure we have that in the loop to make sure there's that seamless redirection process, because we frankly don't trust AI end to end yet, especially if a patient's at a critical juncture, like I brought up substance use navigation earlier. There is no AI that's going to be able to persuade that patient to take that step and go into rehab. You need another flesh and blood human being to talk to that patient, empathize with them, and make that appointment. At the same time, though, as these models do get better and better, the acuity of the tasks that the models can take on will get better and better too. We've seen recently over the past couple of weeks with the launch of reasoning models, the accuracy, the number of nines, as we say in tech, like referencing really the percentage of cases these models get accurately and reliably, are just getting better and better in a dramatic way. So we'll see the scope of these models get bigger and bigger. But even if we can clone the human voice, make it sound supernatural, it'll never be an actual human being. So there has to be that middle ground where when there's a high acuity patient, when there's someone that really needs help, a human being is on the line talking to the patient, being empathetic, being human. And over time, more and more of these mundane standardized tasks will just go away, and our navigators will be able to focus on the areas that really matter and make humans special.
Interesting. We have 2 minutes left. So, Home, you want to close this out here? What's next, and what do you want the audience to walk away with relative to Rely Health?
Absolutely. I think what I really want to end off here with is this idea that care coordination and navigation, that relationship between patients and their care team is going to be the hidden unlock in healthcare. We keep talking about healthcare costs not providing us enough value comparative to every other country out there. And we think at Rely, the solution to that really comes down to this relationship between patients and their care team. And AI isn't all about replacing that relationship. Instead, it's about replacing the noise that gets in the way of it. And to end things off, I'm going to give an example of a patient interaction between one of our navigators and a patient, and one that really stuck with us. And this is standard work. We see one of these pretty much every day from our team, given the high quality navigation work that's going on across the country. So one of our navigators recently met a 72-year-old woman in the emergency department. On paper, her case looked fairly simple. She had a primary care doctor, she had arrived in her own car, and it seemed like she just may need some help scheduling a follow-up appointment. But when the navigator walked into her room, she saw something completely else. She saw a patient that was fully broken. The woman had lost her son on the operating table 5 months earlier. She was grieving. Her daughter had helped her to move in, but only for the mother to find out that her daughter was using intravenous drugs. She was embarrassed, overwhelmed, and really in shock. And as Prithvi has talked about this entire conversation, no AI system in the world can handle that moment. And that's where human connection matters the most. So what our navigator did is, instead of burying this individual in paperwork, various phone calls, having her chase down multiple systems, the navigator just simply helped her take the first step in that journey, finding a new primary care provider, because she hadn't been to one in years. From that point on, the navigator built a relationship with this woman that lasted over the course of 3 to 6 weeks. And a few weeks later, the woman called back. Her daughter had treatment, she was attending counseling, and she had scheduled a new patient appointment for herself finally. And this is what navigation is about. It's not about getting patients care, it's about making sure they don't fall through the cracks. Tom, thank you
Absolutely.
so much for taking time to speak to us.
So Ham, Prithvi, I appreciate it. Great conversation. I wish you guys the best of luck. And the website is
RelyHealth.care.
thank you for your time. That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.